Hello, everyone. Do you know which is the fastest growing neurological disorder in the world? It is Parkinson's disease. And in addition to the debilitating symptoms of Parkinson's, such as tremors, bradykinesia, anxiety, depression, and cognitive impairments, patients also experience significant comorbidities, including increased rate of infections, cardiac, gastrointestinal disorder, as well as fall-related injuries. These patients are heavily dependent on their caregivers. As a caregiver or a care provider, you may be the spouse, the sibling, or even the child or a loved one of someone with Parkinson's disease. Today, we are going to discuss how caregivers can support these patients that are dealing with Parkinson's disease as a part of Parkinson's Awareness Initiative by Medtronic. To give us more clarity on the same, I have here Dr. Charulata, who specializes in this space. I would like to request Dr. Charulata to kindly introduce herself.
So I'm Dr. Charulata Sankhla. I work in PD Hinduja National Hospital Medical Research Center in Mumbai.
Thank you so much, Doctor, for joining us today. I would like to begin by knowing what are some of the common challenges that the caregivers face while supporting a loved one, especially with Parkinson's disease, as you're clearly the specialist in that area.
Yes, there are a lot of challenges in looking after the Parkinson's patient. The caregiver needs to be very optimistic about it because this is a chronic progressive neurological disorder. A lot of changes that occur in the patient because of the chronic nature of this particular disorder. They get kind of very scared when we actually introduce the topic of the diagnosis. Their mood, cognition, the activities of daily living, how they perform the activities such as eating, taking bath, and all that is affected by this particular disease. We now realize that it has a motor aspect of the Parkinson's disease, which everyone knows. That is, they have tremors, they walk slowly, they talk slowly, but they also have non-motor symptoms such as mood, cognition. They are depressed, they are anxious, they get constipated easily, they have difficulty in falling asleep, increased frequency of urination. These are all additional features that we see in Parkinson's disease. So it's very challenging for a caregiver to manage not only just the motor aspect of this disease, but the other aspects of this Parkinson's disease as well.
Oh, that's really helpful. I just want to also ask, how can the caregivers specifically help their loved ones maintaining this positive attitude and during the whole treatment that they're receiving for their Parkinson's?
Correct. So I usually tell the caregivers to engage the Parkinson's patient in various social activities, such as music. If they like music, let them listen to the good music or songs, whichever they prefer to like. It's not like these are the fixed music things that the Parkinson's patient should listen. Art therapy we also use in various support groups that we run all over the Bombay. We encourage them to draw, we encourage them to make things. So we've had Parkinson's disease support groups where the patients are taught to paint, or taught to sketch, make diyas, make various articles. So these are the various things that help. Gatherings help. So the support group it makes them interact with the other patients as well. They talk to the patients, other patients. They understand that there are other problems which are involved. Just the moment is not the problem. And when they meet the person with Parkinson's disease who is similar to them, they form the bonds and they understand that, oh, there is someone with me who's also going through this particular illness. Then we have various other activities that I encourage the caregivers to give, like take them out for all the outings, whether it's a birthday parties or it's a naming ceremony of the young ones. They should socialize. They should not feel awkward because they're trembling or they're not walking properly or they have abnormal movements sometimes associated with Parkinson's disease. They find it very difficult to eat in public because they have handshaking. In spite of all this, the caregiver should give them the positive vibes and they should encourage them to go out and socialize, because socialization is the major key in treating the mood and anxiety of this particular disorder. The Parkinson's patient, the caregivers should also understand have fluctuations in their disease. So at one time, they may be very good when the drugs are acting. At one time, they may not be very good, which we call as an off period, where, the drug has worn off the effect of the medications have worn off and the patient is completely immobile, is not able to do anything. So the caregivers have to understand that these are the periods in Parkinson's patient's life where they are not so good. And during this period, they feel as if everything is lost, all hope is lost, and they feel very low. They start they start having they start having difficulty planning. They start having taking the judgment of the distance that they are going to cross. They have difficulty in parking their car. They have difficulty in sitting in the chair. They tend to misjudge the depth of the chair and tend to sit on the edge and then risking the fall. So these are the things that the caregiver should keep an eye on.
Okay, that's really great advice. I've also heard about some newer treatments that are coming up, specifically deep brain stimulation therapy, and how that they can help patients with the Parkinson's disease. Could you please also elaborate or explain to us that what role the caregivers play in supporting their loved one during this whole deep brain stimulation treatment?
So this is very important treatment, deep brain stimulation surgery. Overall in the world, about 1,75,000 patients have undergone this therapy. So we know we've been using this therapy for the last 20 years in India itself, more than 2 decades. And we've had significant experience with this deep brain stimulation surgery. I just talked to you about the off periods that the patients experience during which they're very low, they need a lot of help, particularly in their daily activities. They can't even walk to the bathroom during these off periods. They need help in dressing themselves. They have to be fed at times. They need help in feeding themselves. So difficulty in swallowing during these off periods. So what this new therapy, deep brain stimulation therapy, has done is uniform the periods in the Parkinson's patient's life. That means have less off periods as compared to earlier. So this stimulation helps them overcome those particular times when it's very difficult for them to move or it's very difficult for them to work. Now, this is very important to the caregiver because it's these off periods which are extremely difficult for the caregivers. And these are the periods which are extremely difficult for the patients as well. And this is where the disability lies. There is a risk of patient falling during this particular period. They need a lot of help while walking. And these off periods make them more disabled and the caregiver has to spend more time with them. So with this new advent of the therapy, we have managed to cut down the bad periods in Parkinson's disease and given them a lot more of a good period in the Parkinson's disease, which we call it on. And that's the basic aim of this deep brain stimulation surgery.
Wow, that's something I think really upcoming and exciting and hopefully will help a lot of more Parkinson patients. Could the doctor please also elaborate the impact of Parkinson's disease on the caregiver and the family members, and how can we support these individuals also?
Correct. That's what I was telling. The caregivers themselves go through a lot of depression and anxiety because of the Parkinson's disease. They tend to kind of feel a little low. They feel helpless, particularly when their loved one is not doing that well. And it also carries a significant financial burden on them because sometimes they have to miss their job. Sometimes they are not able to go to their work properly because the patient is unwell. And they are so constantly involved with the patient that they tend to get depressed with the patient's deteriorating condition. And they need the help as well. So what I suggest to the caregivers is that you need a support system and you need the breaks that you deserve. And I know that you definitely care for the patient, but at the same time, you should be well enough to take care of that particular patient. So if you're not cheerful, if your mood is low, having taken care of this particular patient for a very long time, then the patient is also going to sense that and the patient is also not going to do. So please take a break, um, get help from your family members, get help from the support groups. There are many support groups which also encourage the patient to do all the activities for a few hours, and during that particular time the caregiver can look at it and enjoy those activities or look at it as a break from their routine activities as well. So encourage the caregivers also to take a respite, keep another family member who can take over for them from them for a few hours in looking after these particular patients. Most of the Parkinson's patients in the early stages don't need so much of help. They need only encouragement. As they advance, then they start needing more help with their day-to-day activities, particularly in an advanced Parkinson's patient, where there's a risk of falling, there is more non-motor symptoms which start coming into the play. They start becoming slow in their thinking, start becoming slow in their activities. Sometimes they hallucinate, they see people which are not there. They tend to get a little suspicious, which is a side effect of their drugs. They become paranoid, they start suspecting that somebody's against them. So these things are drug induced, and these also should be kept in mind by the caregiver. I've had a couple of patients where they've locked themselves in that paranoid that there are people coming to attack them. And this is something that the caregiver should be aware of. And this could be the drug side effects, so you should immediately contact the person who's looking after him, the doctors who are looking after him. So these are the very important aspects that we must remember.
Thank you, doctor, for very clearly explaining this caregiver burnout, and we very frequently see this with long-term illnesses. So Dr. Charulata, also can you explain that some tips for the caregivers who are struggling to manage their mental health also while caring for their loved ones during Parkinson's?
Absolutely, they need counseling too, and so they should express their fears to the doctors when they take the patient. They can go to the counselor to be able to cope with this chronic illness burden. We have a support group called Parkinson's disease and movement disorders, which runs the support groups all over Bombay at every center. So it's very easily reachable. And there are many centers which are there all over India as well. So if they can log on to PDMD's website, they'll be able to get these support groups addresses. And they can sort of seek help from there, accompany the patient there, because there are very important tips which are given during the sessions, and that will help them look after the patients better. And stay in touch with the doctor, because there are many new therapies such as deep brain stimulation therapy, which is available, and it's just that the caregiver may not be aware of it, how advantageous it is. So they need to discuss with their doctors the advantages and disadvantages of various therapies that are available for the Parkinson's disease. We know that there is no cure for this particular illness, but at the same time, we don't want the Parkinson's patients to lose hope, saying that, oh, there is no cure. This is a progressive disease. We are doing a lot of research and investing a lot of funds into doing the research to stop the progression of this disease, to find the cure for this disease, at least halt it where it is. And we are on the way. At least we are now able to improve the quality of their life with various different therapies, whether it's deep brain stimulation surgery, whether there are newer drugs, whether they are injectable therapies. So all these therapies go on to improve the quality of life to the patients.
These are all excellent suggestions, Dr. Charulata. Thank you so much for sharing your insights with us today. For more information on Parkinson's, stay tuned to this channel, and you may drop any questions that you have below in the comment sections. Thank you, all of you, and keep watching this space for more information on Parkinson's disease.
Thank you.